Federal funding in limbo.
We'll be there with them in the good times and the bad times.
Programs to support the needs of rural Arizona and children.
I worry that I won't be able to make ends meet because I don't qualify for anything.
Plus more pharmacists throughout the state. This is Arizona Week. Hello and thanks for joining us. Congressional leaders working to renew funding for federal health programs. The fiscal year ended without renewal for things like children's health insurance and community health centers. Federal health dollars are in place until the end of 2017, but beyond that remains unclear. We begin our coverage in Nogales, Arizona, a border town of about 23,000 people located in Santa Cruz County. About half the families in the county rely on the Mariposa Community Health Center for treatment. Among them, Cecy Villarreal, a 3-year-old. She's on Kids Care, a low-cost health insurance program in Arizona. It's federally funded under what is known as the CHIP program. Families on the program earn too much to qualify for Medicaid and in some cases make too little to afford private health insurance. Cutting back on Kids Care means families like Emily's will foot the bill for treatment, or they could opt out of getting health care altogether. Here's Cecy Villarreal, Emily's mom.
Honestly, it's the atmosphere that everyone gives here. It's more of it's home-based. They take extra care with my child as well as myself. They make sure if there's anything else that I need, they will call and follow up. I've had doctors call me before to let me know that they've given me extra prescriptions for my daughter, for myself. So they go the extra mile, and that's what I like.
And tell me about this little child, your daughter.
She is 3 years old. She was born here in Nogales. Her pediatrician is Dr. Wilkins, and she just loves coming here. They're so nice to her every time she comes. She's had, she's been hospitalized in the past, and Dr. Henry was actually the doctor who admitted her, but she was right on top of everything at the hospital. So she was really aware of my daughter's needs at the time.
Now, aside from that little noise she's making, she's healthy. I mean, you haven't had any major complications.
No, she only had a little hiccup when she was about 3 months old, but other than that, she's been very healthy.
Okay. And what type of health insurance do you have for Emily?
I have her right now on Kids Care.
Okay. And explain what Kids Care is, what you've had to do to enroll her.
Well, Kids Care is basically, we don't meet the range for access. So Kids Care allows me to get the benefits for her to be able to see the doctor if she's feeling sick, or her dentist at a low cost to me. So I do pay a monthly premium, but it's relatively inexpensive for myself. And it gives me, like I said, the opportunity for her to see the doctor whenever she needs to.
Should there be a reduction in funding or Kids Care changes as you know it? Can you afford to pay for her health care, given that right now you don't meet the criteria for like Medicaid or access? Mariposa
has a wonderful program, actually. We're under Blue Cross Blue Shield. And I'm a one-income household, so it is a wonderful program. However, for a one-household family, it's difficult to pay close to $90 every paycheck. So to be able to make ends meet, I don't think, if I'm having a hard time now, I would be having a harder time if I would have to switch over to my company's insurance. It's a great insurance, it would set me back a little. And so I wouldn't be able to give her the things that I give her now, and I wouldn't be able to bring her as much to the doctor. If I would have to take her to the emergency room, it would be a lot harder for me to do so with another insurance.
Do you think about if the funding is reduced, how that changes your life? I mean, what sorts of things would be different?
Yes, of course. I think about it ever since I found out that this could very well happen in the near future. I worry about it constantly just because, like I said, it's only me making, ends meet for myself and her, and we're only 2 people, but at the same time, it costs, you always have bills to pay, you always have, unexpected expenses, and so I worry that I won't be able to make ends meet because I don't qualify for anything. And the one thing I do qualify for, it gives me that satisfaction of knowing that if something's wrong with her or if she needs to go to the doctor, I can do that for her. I'm not so sure that I would be able to say the same if they were to take away the program.
What do you wish people knew about families like yours, single mom who's working hard to make ends meet?
No, I wish people would know how hard it is to try to make it on my own. You know, it's great. It feels good that I'm not dependent upon anyone, but at the same time, all of these families, including myself, we're struggling to be able to continue to do that, but we're not receiving the help that we need, because it's not because I want it or because I think I deserve it. It's because without it, I'm lost, essentially, because I do need that extra little money to make it through the week or make it through the month with my expenses. So, you know, I don't think I'm entitled to it, but I think I work hard enough where I should be able to know that my daughter can be treated if she were to need it, without me having to struggle financially.
Since the 1980s, the Mariposa Community Health Center has provided care to patients, and it's grown over the years. More than 280 employees, about 30 are physicians, nurses, and dentists. Patients get care at one of the 4 offices in Santa Cruz County. Ed Sicurello, the CEO, says the center is not in crisis and is prepared to move forward with or without federal funding.
We were founded on a belief that healthcare is a right, and not a privilege. So that really is what drives us as an organization.
Tell me about some of the needs of this community, because it is unique when you're in a rural border town and you don't quite have access to big city healthcare.
It's very difficult for many patients to get to Tucson for care. Some of it may be transportation. Some of it may be patients who are hesitant to go north, even though they have legal status, even though they're here and have every right to go north, they're hesitant to go north. So I think having local primary care providers is probably the most critical need.
Economically, are your patients challenged in that area of being able to afford adequate care?
Now, 50% of our patients qualify for access.
So what does that mean for this clinic as far as, maintaining a budget and staying where it needs to be?
Yeah, and we are we're fortunate. We've been here a long time, and we are a very strong organization. But with that said, and with 50% of our patients qualifying for access, that is actually closer to 70% of our revenue. So access coverage is extremely important to us and to our patients.
Now, at the federal level, the funding at this point appears to be a moot point almost. The state may step in, but it may not. So are there contingencies in place to support this place?
Well, at the federal level, our health center funding is kind of in limbo, but it hasn't gone away yet. It's in limbo. I'm cautiously optimistic that it will continue. As I said, we're fortunate that we're a strong organization, so we do not need to make drastic, immediate changes. But if our funding is not restored at its current levels, that's about $2.5 million reduction for us. And we can't sustain that kind of reduction for a long time, so we would need to have very thoughtful planning about what services we can no longer continue to provide or need to provide in a different way.
When you talk about planning in the future, and if the funding is no longer available or it's reduced, that almost translates into job loss or discussions about job loss.
Yeah, and that's a really tough one to process because you immediately start to think about and talk about fewer providers, seeing fewer patients, but that also results in less revenue. So there's really a balance there, and I think we would have to look more strongly at what services we provide that are not paying for themselves. A lot of our community-based services, some of the services in terms of assisting community members with eligibility, transportation services, those are probably the first things that would be impacted.
The Mariposa Community Health Center prides itself on what it calls a value-based environment that includes doctors who connect one-on-one with patients. Dr. Tanya Henry is one of the pediatricians. She sees about 2,000 patients, a Louisiana native who came to Arizona open to embracing the culture of a border town.
I wanted to be somewhere where I could improve my Spanish and just kind of immerse myself in that kind of culture. And out of all the places I interviewed in the Southwest, this was the place that I felt most at home. I felt like this was where I was supposed to be. And I think what's kept me here is I still continue to feel that there's a great need here in Nogales, and I feel like the clinic does a wonderful job providing basic services to the community and above basic services. The social outreach programs that we have are programs that you don't necessarily see unless you're next to a big tertiary academic medical center, and so it's just really nice to be a part of an organization that has those opportunities for our patients.
Mm-hmm. What sorts of health needs do you often see in your patients? Does it run the gamut?
Yeah, definitely. I think the biggest health need that I see that kind of goes unaddressed is just primary care, just basic primary preventive care. There's a lot of times when people will lose their insurance coverage and they will kind of be away from their primary care physician for quite a while, several months, sometimes years. And then as soon as they get their insurance back, then they come in for that visit. And I thought it was really interesting because when I was in residency, as a resident versus a community pediatrician, you see things differently. So for instance, as a resident, any patient that I had that wouldn't come to their visits, I said, oh, this patient is so non-compliant. I can't believe they don't care about their child. And when I came here, I realized it's not that. People have a lot of things going on in their lives that interfere with their ability to pay for medical care, that interfere with their ability to access medical care, whether it's insurance, transportation, money. And I have a lot of patients that they want their child to have medical care. It's just sometimes it's almost an impossibility.
What is your perception of how these families are trying to accommodate their children's health needs, but they simply can't, or the resources aren't there?
I think a lot of people don't know about the resources that are in place. For instance, through different things regarding kids care or with access even, or with the clinic. A lot of people are unaware that transportation is available through that. Transportation is a big thing. Either you don't have a car, or you have a car but you don't have money for gas, or you have a car but nobody wants to drive on the highway to get to Tucson, so there's lots of things, and people don't realize that just their basic transportation needs can be covered via their insurances or via the clinic services.
Okay. What sorts of illnesses or conditions do you see children facing? I mean, not just here, but in general. I mean, you're a pediatrician. What sorts of issues do children face?
It's interesting. One of the biggest, I would say a couple of the biggest challenges that I'm looking at right now are obesity, of course, and tooth decay. And they kind of go hand in hand. So tooth decay is like one of the biggest causes of chronic infectious disease in children, actually. People don't know this. And it's so preventable. Just to be able to have regular dental visits starting at the age of 12 months, to be able to have information about using fluoride-based toothpaste, brushing teeth, getting rid of bottles, it's huge. And that's one of the things that Access provides, one of the things that Kids Care provides, and it's something people don't think about because they have their teeth. But when you're little, and maybe your parents don't understand how to take care of teeth because they're not coming to preventive well-child visits, or they don't have access to dental care, then that's huge, and that affects quality of life in terms of ability to eat, ability to speak, how you're going to feel in school if you have no teeth, increases your risk of having health problems if you have to go under general anesthesia to have dental care done, which is happening in a lot of my patients. And these are normal kiddos. It's not that these are kiddos with special needs. These are normal, healthy kiddos that just have terrible teeth, and it's totally preventable.
Like obesity, for example, that feeds into other very serious diseases that will last
Definitely.
a lifetime.
I never thought as a pediatrician that I would be on the phone with parents telling them your child has triglycerides in the 200s. I never thought I would hear that. Your child has elevated LDL, which puts them at risk of early heart attacks. Like, I never thought when I became a pediatrician that my work would include managing lipid levels. I just never thought that would be a possibility, but unfortunately it is.
So without you, without this facility, what would become of this community and its future?
It doesn't look very good. I think this clinic and clinics like us around the country are just so important and so vital. I mean, the population that we're serving might seem small relatively, but these are kids that are going to grow up, enter the workforce. These are the leaders that we have. And if they're unhealthy, they're not able to get the quality care that they need, to be able to be in school, to be able to do well in school, to be able to learn. You can't learn if you have high lead levels. You don't know you have high lead levels until you're checking them, and you won't know to check them until you go see your pediatrician. There's just everything cascades. So I think without a clinic here, I think it would just be disastrous.
All over the country, states wait to see what federal lawmakers will do with the future of funding for the CHIP program and community health centers. Funds are based on enrollment, and many states, including Arizona, are covered until at least the end of the year. Here in Arizona, Kids Care covers about 23,000 children. Access, that's the Arizona Healthcare Cost Containment System, the state's Medicaid agency, says that translates into about $22 million in federal funding. What happens after December is not known. If the feds have not acted, then it will be up to state lawmakers to create a backup plan or do nothing. Dr. Eladio Pereira says that leaves community health centers like his in financial limbo, but continuing to provide care to its community, and that begins with hiring good doctors.
It's been difficult to recruit primary care doctors across the state, and it's been particularly challenging in Nogales. Issues of border location, political issues, all that has been quite difficult. I think in the last several years things have improved somewhat, but it's quite a challenge. We look for a specific kind of provider. We look for doctors who are competent, who are skilled, well-trained, but we also look for doctors who have an awareness of our culture, an awareness of the challenges that our patients face, and doctors that have really empathy for others. So when you look at all those, for the lack of a better word, requirements, it's not an easy task. It has to be a doctor who is willing to work with others during challenging situations. So it takes us a while to recruit those kind of doctors.
You've been here for more than 30 years. How have you seen the health needs of this community change?
I think the healthcare needs, I think they're about the same. I think they're looking for good doctors, people who can listen to them, people who can make diagnosis and treat and make them feel at home. I think Mariposa has done very well in terms of being a second home for them. We not only provide medical care as such, but we also provide comprehensive care. We do have an integrated behavioral health model where patients who need special advice, counseling, can get that. We can provide certain services under the same roof. And we continue to provide that under challenging situations. So I think in terms of the patient needs are about the same. I think Mariposa has expanded services over time based on those needs.
There are some issues that affect Latino populations like obesity and diabetes. Do you see that addressed enough here at this clinic?
I think we are. I think we have an excellent community health services department that addresses patient education, advice, and early recognition. I think diabetes is particularly prevalent. We've been able to work with our patients on not just diabetes prevention, early recognition, but treatment. And that's always at the top of our list. One aspect that has been very helpful to us is that because we have our own pharmacy, we do know that patients get their medications, whether it's a pill or whether it's insulin. We work very closely with our pharmacists to make sure that the medication needs are addressed, and that's been very helpful.
I can imagine that when Medicaid expansion went into effect, you saw more patients. Do you worry what will happen if Medicaid funding is reduced, what that means to your waiting room, for example?
Absolutely. When Medicare expanded, we saw an increased number of patients right away. And not just the volume, but also diagnosis that were quickly made. I speak about the story of two patients that we saw early. Both patients were diagnosed with cancer. One of them was recognized early. The other one was advanced when we made the diagnosis. The patient waited until she had insurance to come in, and it was too late. So we know when insurance is lost, whether it's Access or some other insurance, patients don't come to see the doctor. They wait until symptoms progress. Diagnoses are typically late, and treatments are typically late, so the complication rate goes up. And we do know that some patients die prematurely because of the lack of access to health care. And you probably know, primary care is the anchor. You got to have a good primary care network in order for patients to be managed properly.
If funding is reduced, maybe there are fewer providers, that sends these patients where?
Well, many of them don't have anywhere to go. I mean, I think like always, some may have a choice based on their resources, but we're very aware that many of our patients would not be able to go anywhere. So we will have to continue to look for ways and other resources to manage them. I think we have managed that over the years. We have a good team that is creative, innovative to look for other ways, but many patients don't have anywhere to go. So, but we're going to be there with them all the way. If they lose their insurance, we'll find a way. We'll be there with them in the good times and the bad times.
The effort to recruit and retain physicians is nationwide. It's also true for pharmacists. Here in Tucson at the University of Arizona, the College of Pharmacy is nearly doubling its class size, hoping that more pharmacists throughout the state means a healthier population. Elizabeth Hall-Lipsy is an assistant professor who's focusing her efforts on the college's Rural Health Profession program.
Well, the Rural Health Professions program is actually a statutorily created program that started in the late 1990s. And so it's a neat program because it involves all four of the health sciences colleges. So you have medicine, nursing, pharmacy, and then later public health was added. And so as a part of this program, the intention is that at 3 points in a student's professional education, he or she's placed in a rural community for their clinical education. So they spend hours on rotation at hospitals or other healthcare facilities. Specifically for pharmacy, it will be a community pharmacy or a hospital or a clinic where there's a supervising pharmacist to train them. And the purpose of the program is to expose our students to those rural communities. And many of the communities are so excited to get our pharmacy students because it's an opportunity to showcase what rural practice is like.
Oftentimes it's hard to recruit physicians to rural Arizona. You're saying the same thing for pharmacists.
Without a doubt. About 85% of our population lives in urban areas, and about 90% to 95% of our practitioners live in urban areas. So that leaves about 15% of the population that only has about 6% of the practicing pharmacists. So there's a huge gap between the number of people and the pharmacists that are providing the services to them.
And how is it that you get pharmacy students to agree to move to a place that is very different from Tucson and some of the other big cities where they may have come from?
Well, and it's a real challenge, especially for some of our really isolated rural towns, places that might be on Indian reservations or Native American people, to some of our border communities. And I think for some students, that's actually an incentive. That appeals to their sense of adventure and their sense of purpose and service to others. But the way that the program is created, as an enhancement that the College of Pharmacy implemented, is we created a professional certificate in health disparities. So it provides the student something at the end of their education that says, I purposely selected to work in communities with the most need. I've been exposed to these populations, and we hope, and some of the data we've been tracking from graduates, that they are then more employable and that they can go to more prestigious programs. Many of our students pursue postgraduate training, which is very helpful for a pharmacy career, and about 40% of our students go on to practice in rural areas at some point after their graduation.
This speaks to that comprehensive health care that we hear so much about. One of the things we saw in Nogales this week, you see the physician, he or she prescribes your medications, and then you walk feet away and you're being helped by a pharmacist.
Well, and that's so essential to providing the best care to a patient. There's so many difficulties, particularly for a rural community, if you don't have that comprehensive care approach. So for a lot of rural patients, let's say you need to see a specialist and you may have to travel to a larger community, and that specialist is perhaps going to prescribe some kind of medication to treat the condition. Now the patient has the option to filling that in Tucson or a larger community like Tucson or Phoenix and then traveling back, but then in 30 days, how do you get your medication again? And so that model of care that a lot of our community health centers is so popular for our students because they do feel like they're part of a healthcare team, and the providers begin to know one another. And if they have a question or they have a concern, it's a lot easier to call up your friend in the building next door as opposed to having to call a pharmacy or a medical clinic that you might not have a relationship with.
And this program is expanding. You just received an infusion of cash that will help you grow.
When the program was initially created, the state legislature funded the program. Now, written into that particular funding legislation, it provided for 4 pharmacy students a year, which is hardly enough students to make any kind of impact in our rural workforce. In the mid-2000s, the Arizona Health Education Centers decided that the Rural Health Professions Program would be one of their main priorities. And so they provided additional funding to increase the programs. From that money, we were able at the College of Pharmacy to take our annual allotment of 4 students up to between 20 and 30 students per class year. Now, one of the things that's been happening simultaneously is that our class sizes have also increased, but our funding hasn't matched that. So with this amazing generous award from the Blank Family Foundation, we're able to add an increase in the same size as our new class sizes. So we're hoping to take in a new class size of about 35 students into this program. So each year we take in a new class of 35 students.
What's the ultimate goal, the vision for a program like this in Arizona?
The goal is to begin to create a pipeline where we have kids who are living in rural communities who think, you know what, I want to go be a doctor, I want to go be a pharmacist, and I want to come back to my community and show the other kids that I can do this. And so we're starting to attempt to recruit students from some of those rural communities in Arizona, and many of the programs at our health sciences campus support that. But at the end of the day, we'd love to see more and more providers going out to rural communities and even our underserved urban communities as well.
Diversifying the medical field.
Without a doubt. There is so much in the literature that shows that when you have that kind of concordance, when the person that's treating you understands your background or can appreciate the social circumstances that you experience, your care is improved and your trust in that provider is increased.
Wonderful. Okay, Elizabeth, thank you so much.
Thank you.
The Rural Health Program at the College of Pharmacy began in 1997 with 4 PharmD students, and it's grown every year since with at least 20. As of May last year, more than 86 students earned the certificate. And that's our program. For all of us at Arizona Public Media, I'm Lorraine Rivera. Thanks for joining us.